Welcome to the second in our series of webinars developed for people with newly diagnosed celiac disease. This session will look at the process for diagnosing celiac disease. Taking you through this series will be our presenter Leah Seamark, who is a specialist gastroenterology dietitian. She'll be joined by a panel of NHS specialists who will be asked various questions throughout the series. For those of you who listened to the session 1, you will have heard Dr. Emma Gregg briefly mention some of the procedures undertaken to diagnose celiac disease. I will now hand you over to Leah, who will explain the overall process.
Now let's discuss getting a celiac disease diagnosis. So if you have any of the symptoms or you are concerned you might have celiac disease, the first thing you should do is visit your GP. Now, at an appointment with the GP, they'll discuss your personal and family history and carry out an assessment of your symptoms. If they think it's worth exploring the possibility of a celiac disease diagnosis, the first thing they'll then do is send you for a blood test. Now, in the blood test, they're looking for a specific antibody related to celiac disease, and that antibody is called an immunoglobulin A tissue transglutaminase, or IgA-TTG for short. Now, if you have a positive blood test, so higher than normal levels of that antibody, or if you have a normal blood test, however, celiac disease is still strongly suspected, you'll then be referred to gastroenterology in order for you to have an endoscopy to get some gut biopsies. However, there are some instances where that may not be the case. So, for example, in children, it may be that a diagnosis is made without a biopsy in certain situations. And also, due to recent events, including the COVID-19 pandemic, the British Society of Gastroenterology have recently released some interim guidance on celiac disease diagnosis. They are suggesting that celiac disease could be confirmed without a biopsy in certain situations. And the criteria they say should be met to confirm the diagnosis without a biopsy include that someone presents with symptoms consistent with celiac disease, that the blood test they have is 10 times the upper limit of normal for the levels of the antibody IgA-TTG, that they're under 55 years old, and that there are no alarm symptoms. If all that criteria are met, at this moment in time, it's maybe possible to confirm the celiac disease diagnosis without the biopsy.
Clearly, there will be some people that don't meet this criteria, and for them, an endoscopy will be necessary. Emma, would you mind taking us through what an endoscopy involves?
So an endoscopy is a procedure that you have in one of the endoscopy units. You need to have nothing to eat for the 6 hours beforehand and nothing to drink for at least 2 hours beforehand, so that we make sure your stomach is nice and empty. You come up to the unit, you'll go into the room, and there's usually 2 or 3 different ways of having the procedure done these days. It's usually done via the mouth. We can either spray the back of the throat to make it numb, to make it easy for you to swallow the endoscope, which is a little thin tube about as thick as your little finger. Or alternatively, you can have a sedative which makes you feel woozy but won't put you to sleep. We'd aim to undertake the endoscopy, which is a quick procedure which takes less than 5 minutes, aiming to pass the scope in through your mouth, through your gullet, through your stomach, and into the first part of the small bowel just to take some biopsies. It's over very quickly within 5 minutes. We can send the tissue off to the lab. You would then be able to, your swallowing would come back to normal if you've had throat spray. The sedation wears off fairly quickly, and you'll then be able to go about your normal day.
Brilliant, thank you, Emma. So once you've had the endoscopy and those gut biopsies are sent off to the lab, it's there where they'll look at the biopsies under a really strong microscope and they'll assess the extent of damage to the lining of the gut. And that will really determine whether you have celiac disease or not. So one of the really important things about this diagnostic process is that it's really, really important to continue to eat gluten throughout until the diagnosis is made. So you should be having gluten before the blood test and before the endoscopy. And Emma, can you tell us a little bit about why that is?
We don't want to get a falsely negative reading. If you've already started a gluten-free diet, then the lining will have started to change back towards normal, and it may be that we don't capture the changes.
So it's very much, if you have started on the gluten-free diet, you may then get a false negative result at the blood test and the endoscopy. And Danny, can you give us a little bit of information about how much gluten someone should be having before they have the blood test and the endoscopy?
There's no real hard and fast rule with this absolute specific amount, but it is a question that we get asked quite a lot. And we tend to say that at least in more than one meal a day for 6 weeks prior to the blood test would be sufficient. So if you're thinking about a gluten-containing cereal, a slice of toast in the morning, maybe some breaded fish or chicken in the evening, that kind of thing. But yeah, more than one meal a day.
Thanks, Danny. So a question for our consultants. I've had a positive blood test. I'm sure I have celiac disease based on my family history. Can't I just start the gluten-free diet, start to feel better and not have the biopsy?
A gluten-free diet is quite an undertaking, and it's a lifelong undertaking, so it's very important to be absolutely certain that the diagnosis is correct. And it is possible to have a false positive blood test where the TTG antibodies come up positive, but in fact you haven't got celiac disease. So I think you want to be 100% sure and confirm that with a biopsy.
So another question we have for our panelists is, I've recently been diagnosed with celiac disease. Will my kids get it, and should family members be tested?
As Leah has already said, the risk to a first degree relative having celiac disease is about 1 in 10 or 10%. So it is definitely worth thinking about getting tested if you're having symptoms or any of your first degree family members are having symptoms. So that's your mother, father, brother, sister, any children. There is some question about whether people should be tested even if they haven't got any symptoms. But again, it's something to talk about with your GP.
Thanks, Emma. So it's very much, if you have children and they have symptoms, definitely go and get them tested. Or if you do have any concerns, it's worth going and having a conversation with your GP about getting them tested. So another question for our panel is, following biopsy, I've been told I have celiac disease, but the biopsy only showed mild damage to the gut. Does this mean that I don't have to be as strict with a gluten-free diet?
Unfortunately not. It's very important to be very strict with the diet, and in this case, no, they shouldn't have a trace of gluten in their diet. There's still the risk that they will malabsorb nutrients from their diet. So no, you have to be very strict.
So regardless of the extent of damage to the gut, if you have a diagnosis of celiac disease, it is a strict gluten-free diet. So another question is, will I need another endoscopy and biopsies once I've started the gluten-free diet?
Now, just occasionally practice here is a little bit different around the country, but I think, Jim, you'd agree with me that we hold the view that if someone's well after they go onto a gluten-free diet, their bloods have gone back to normal and they're not having any symptoms, then we really wouldn't want to go ahead and repeat an endoscopy.
So it sounds like if a person has started the gluten-free diet and their symptoms have improved and their bloods have returned to normal, you won't necessarily do a repeat endoscopy. However, obviously, if people do have symptoms, that might be something you consider.
We would certainly do that. So if, say, at 3, 4, 5 months, they're still having problems, particularly if there's signs that they're still anemic, their antibody level isn't coming down on blood tests, because you'd expect those things to be going back to normal by then we might think about whether they've got refractory disease, which is a very tiny percentage of people with celiac disease. But sometimes we need to think about more than just a gluten-free diet. However, it's only worth doing if that is the case.